Hi everyone, thanks for joining. We're going to get started now. Today we have Dr. Moore here, so we'll turn it over to him for some brief remarks.
Good afternoon. Bon après-midi à tous. It has been almost 3 weeks since schools resumed in-person learning and 11 days since Ontario began its gradual reopening. And I am pleased to report that our healthcare and public health indicators continue to demonstrate an improvement in the COVID situation in the province. The average for new COVID-19 positive admissions to hospital continues to decline, as do the total number of patients in hospital with COVID-19. Similarly, the average for new admissions to the intensive care unit and the total number of patients with COVID-19 in the ICU both continue a downward trend. The percent positivity of PCR tests continues to decrease, with our average this past week declining to 13.42% from 14.64% the week prior. There are also fewer new outbreaks in long-term care and hospitals and a declining number of residents in long-term care with active COVID-19 infection. In addition, almost half of all wastewater samples in the province are showing a downward trend in SARS-CoV-2 detections. With the recent decline in COVID-19 related hospitalizations and ICU admissions, as well as stabilizing health human resources in many organizations, we are now in a position to lift Directive 2 to gradually and cautiously resume non-emergent and non-urgent surgeries and procedures in public hospitals. Avec le déclin récent dans le nombre de hospitalisations et des admissions aux soins intensifs liés à la COVID-19, ainsi qu'une stabilisation des ressources humaines dans de nombreuses organisations dans le secteur de la santé, nous sommes maintenant capables de retirer la directive 2. Cela nous permettra de graduellement reprendre les procédures médicales et interventions chirurgicales non émergentes et non urgentes dans les hôpitaux publics. Resumption of these services will follow a planned, phased approach across the province in alignment with guidance provided by Ontario Health and oversight by regional officers working with local hospitals. We know the health system is still strained in some regions, and Directive 2.1 remains in effect to support patient transfers to maximize healthcare capacity across the province. As these services resume, it will be critical that our health system partners proceed cautiously and continue to demonstrate the tremendous partnership and collaboration they have shown to date so that all regions have the capacity to resume services slowly. The situation in our schools also remains encouraging. As of February 8th, 99.9% of publicly funded schools were open. The percentage of school absences was 10.7%, an almost 2% decrease from the week prior, and 8.3% of staff were absent. The average total absence rate in the province was 10.5%, with 5 schools reported as closed. Thank you to our educators, our parents, and students for their continued dedication to keeping our schools as safe as possible for in-person learning. And this includes immunization. We continue to make progress in our vaccination campaign for our 5 to 11-year-olds. 54.7% have received 1 dose and 25.4% are fully immunized. And 87.3% of youth aged 12 to 17 have received 1 dose, and 83.9% have received both doses. To further increase our student immunization rates, close to 330 school-based clinics will be held by public health units across the province from February 7th to the 20th, and close to 420 school-based clinics were held from January 17th to February 6th. With these positive trends and strong safety measures in place, students can once again benefit from extracurricular activities, including high-contact sports and musical activities such as choir and wind instrument ensembles. En raison de ces tendances positives et des mesures de sécurité en place, les élèves peuvent à nouveau participer dans les activités parascolaires, dans les sports de contact, ainsi que des activités musicales. Health and safety measures will continue to be in place, including masking. Students and other participants will be required to wear a mask while on school premises, but may temporarily remove it to enable active participation in activities such as playing basketball or to play musical instruments. And I know these activities are critical for the physical, social, and mental well-being of our children and youth, and I'm pleased that we are now at a point where students in Ontario will once again be able to access these activities within a school setting. With respect to our vaccination campaign, I want to thank Ontarians for rolling up their sleeves. An incredible 92.1% of Ontarians aged 12 and over have received one dose of a COVID-19 vaccine. 89.6% have received 2 doses. This achievement is to be applauded, and I thank everyone who's come forward. 6.6 million Ontarians have already received their booster dose. Booster doses have been shown to reduce the risk of severe outcomes from Omicron, such as hospitalization and death, by around 90%. And they have also been shown to be 60% protective against symptomatic disease. I continue to encourage all those eligible who have still not received a booster to please get their shot as soon as possible. We have been receiving a lot of questions about when it's best to receive a booster dose post-COVID-19 infection, and individuals infected with COVID-19 after their primary series but before their booster dose are recommended to receive their booster dose around 3 months after symptom onset or a positive test. Les individus qui ont été infectés avec le COVID-19 après leur première série de vaccins, mais avant leur dose de rappel, sont recommandés de recevoir leur dose de rappel 3 mois après le début de leurs symptômes ou tests positifs. Emerging evidence indicates that a longer interval between infection and vaccination is associated with improved antibody responses to COVID-19 vaccines. With informed consent, individuals may receive a booster dose once they become asymptomatic after infection and have completed their isolation. With encouraging trends in community transmission and our hospitalization and ICU admission trending downwards, we can now see that Omicron peak is behind us. This is thanks to the collective efforts of Ontarians following the public health measures we know work, as well as our high vaccination rates. It's now time that we start focusing on resuming certain procedures in our health system, as well as the other aspects of our society that improve our social and well-being. This means that we are actively planning what the future looks like and laying out timelines for what public health measures can be lifted and when. Cela veut dire que nous planifions activement pour l'avenir et nous nous fixons des échéanciers pour déterminer quelles mesures de santé publique pourront être levées et quand. COVID-19, though, is not going away. We need to continue to apply what we have learned and know what works. It's clear that the situation in Ontario today as it relates to COVID-19 is different than when proof of vaccination and masking requirements were first introduced. And with this in mind, we are looking at the plan to consider when we can recommend to government what additional measures can be eased. This includes keeping our masks on for a while longer, and with high vaccine coverage in the population, planning for when proof of vaccination can be discontinued. This and other measures would be considered in relation to lifting of other restrictions and the ongoing health and safety measures that would remain in public settings. Our plan has always to be data-driven and follow the best science, and the decisions that we make in the coming days and weeks will continue to be based on the best evidence. These discussions are ongoing, and we will have more to say in the coming days ahead. Thank you. Merci.
We'll go to the phone lines for questions. Just a reminder, it's 1 question, 1 follow-up. Over to the first question, please.
From Chris Rushery at the Toronto Star.
Hi, thanks for taking my question. Community sports resumed for kids a couple of weeks ago, and high school coaches are saying that they don't understand why high-contact sports in schools weren't also given the go-ahead. Can you explain why there was the delay for school sports resuming?
I think from a safety vantage point, we had to make sure that all the layers of safety were in play and were working well within our school setting. I did see the conflict of community settings opening up and not having them available to students in the school setting. And as a result, we've made direct recommendations to government to ensure that they now run in parallel. I'm sorry for any delay in enabling this, but this was to ensure that we had all the safety protocols in play and that our school absenteeism rates remained relatively stable. We, in addition, in school settings, continue to have very good safety protocols that would enable this activity to remain safe and to be opening up in a process across all of Ontario.
Follow up?
Thank you. Yes, and with regards to masks in schools, Alberta's ditching them next week. Saskatchewan's following suit at the end of the month. And I'm just wondering if this is something on your radar, or do you expect that masks will be in place in schools for the remainder of the school year?
Thank you for that question. So we're reviewing all public health measures and making recommendations to government. I would think my initial feeling is that we keep initially measures in the school setting to ensure that parents have confidence, workers have confidence, and students have confidence to go to school. So I anticipate that the measures that we may remove at a societal level will remain in the school setting a bit longer to maintain that safety protocol. We don't want to lose any days in school. We want to maintain presenteeism in the school setting and ensure all children feel confident and comfortable in the classroom. So my gut's telling me that we'll delay any removal of public health measures in the school setting after we remove them at a population or community level.
Next question.
From Brian Lilly at Toronto Sun.
On that note about masks and vaccine passports, you have commented as recently as last week that vaccine passports and other measures are something to review. What are your thoughts on lifting them at the community level? Is that something in the near future? Is that something that we should expect to be added into the province's reopening plan soon? Because currently, out to March 14th, there's no mention of what to do about vaccine passports or masking. Should the public expect an update on that soon?
Yeah, thanks so much, Brian. We will be reviewing the evidence, and as I've said today, the evidence is showing we're making remarkable improvement in all of the key metrics in Ontario, and that forces us to review all public health measures that are in play. None of them are expected to remain in play longer than they need to be or have a benefit to protect Ontarians. So we are reviewing all of them in the coming days and anticipate we'll make recommendations to government as soon as next week, and there'll be greater clarity for all Ontarians to understand the processes that we'll put in play and the timelines for removal of all public health measures in a graded, cautious manner, which has been the cornerstone of Ontario's approach.
Follow up?
What would you say to people who are claiming that some of the provinces have already moved on measures because of pressure from the protests in Ottawa at the Windsor border crossing and elsewhere, and that anything you do now is just going to be giving in to the protesters, and therefore you shouldn't do it. You should keep everything in place.
I hope all Ontarians are watching the data as we are, and it is showing a remarkable and rapid decline in risk to hospitalization, in risk to get admitted to the intensive care unit. And our approach in Ontario has always been to follow data, and that data is showing very positive trends. And I think, as you've said, Brian, you've heard from me before, we will always follow the data. No public health measure should be in place any longer than it has to be, and hence, without any external pressure, because I don't really watch the news too much, we are absolutely committed to removing public health measures in a timely, evidence-based, science-driven science-driven manner, and we'll be making recommendations to government next week. We'll be monitoring the trends all weekend, but I can't thank Ontarians enough for continuing to wear their masks, wash their hands, get their first, second, and third doses. It is protecting us. It's protecting our health system, and as a result, all of the metrics are improving dramatically.
Next question.
From Cynthia Mulligan, City News.
Hi, Dr. Moore. Back to the question of passports. Last week you were saying that they do need to be reviewed, but you were also saying that if you have 2 shots, that you can still get COVID and you can still pass it on. So if you're going to a restaurant and let's say, 90% of people have 2 doses and 10 don't, or some have 3 doses, is a passport relevant anymore in that situation to prevent you from getting it if you only have 2 doses?
Well, I will reiterate that we have a layered approach to measures within restaurants and in most public venues where there's screening for symptoms. There is masking when you're moving within those facilities. You take your mask off when you sit down. So proof of vaccination is only one measure of a suite of measures that are in place to protect all of us in public spaces and in restaurants, bars, and other venues. The utility of them always has to be asked, and if they are less useful over time, and as a result of the vaccines, they're so beneficial against severe outcomes. So there is a place to ensure that people are vaccinated with the proof of vaccination. I think they've done their job to protect people in those venues. But there comes a time when we have to reconsider and review their ongoing utility. And as the risk goes down in our communities, we have to look at removal of proof of vaccination in all of those settings.
Follow-up, Cynthia?
Yeah, sorry. I'm sorry. I wasn't sure if he was finished. Thank you. Let me rephrase it a little bit. Are vaccine passports, and yes, with the additional measures, but should they either be scrapped or should they be upgraded to 3 doses? What would the best science be on this?
So I think we have to be realistic. We have 6.6 million Ontarians that have come forward for their 3rd doses. We're not going to hold back and mandate through proof of vaccination that 5 more million Ontarians get immunized with 3rd doses. 2 doses is exceptionally protective against admission to hospital. It does protect you against ending up in an intensive care unit and or death. It's done its job protecting Ontarians, and because 12 plus we have over 90% protection now, I think it's a prudent time to review proof of vaccination as one tool in a multi-layered approach for these venues.
Next question.
From Colin DeMello at CTV News.
Hey, good afternoon, Dr. Moore. So some people in Ontario might be looking at provinces like Alberta and Saskatchewan and wondering what is taking Ontario so long. So could you outline what is the difference that you see in Alberta, for instance, that allows that province to remove all of its COVID-19 restrictions almost immediately while we take the slower approach? What's the difference?
To be honest, Colin, I don't spend a lot of time focusing on Alberta or other provinces. I am focused on Ontario, and I think our plan is reasonable. So if you recall, we've built the date for February 21st of reopening. That date may be reviewed next week, given the significant improvements in all of the key metrics in Ontario. As well, you may recall we had a date of March 14th for subsequent opening of mass gathering events. I think given the rapid decline in all our case counts, we will follow Ontario data. We will make Ontario-based plans. We will continue to follow our gradual phased approach. It has worked so well for us and protected so many Ontarians, and just recently has been able to, I think, mitigate the number of Ontarians having to end up in hospital and intensive care unit settings. I thank all Ontarians for their sacrifices because it has helped us all collectively protect our health system, and we're in a very good position position to reconsider timelines as well as all public health measures. Eventually, these are government decisions, but we will make an Ontario-focused, Ontario-based, data-driven, science-driven decision by government in the coming week.
Follow up?
Okay, thank you. So it sounds like those dates that we have, the 21st and the March 14th, are almost no longer going to be in effect, that you could potentially move them up by a few days, if not a week. I'm wondering, so what can businesses expect here? Capacity, is that going to be moved up? Or what measures are you willing to speed up, and which will be the last to return? So a large sporting event, would that be the last to return? Capacity limits, could that be sped up? Give us your take on dates and what could change.
I would look at the dates that have been provided, February 21st and March 14th. All those measures that would be opened, it's now given how well Ontario has done in the Omicron wave, how well our health system is recovering. I would assume government wants and will review timelines as well as all public health measures, including when we remove proof of vaccination, when we remove masking in certain venues. I do think masking in public indoor spaces like transit, subways, buses will be maintained until we really have very low endemicity, and that would be cases below 10 per 100,000 on a weekly average, which would have correlates with hospitalization and ICU utilization as well.
Follow up?
I already had my two. You can go to the next journalist. Thank you.
Last question.
From Holly Mackenzie-Souter, Canadian Press.
Hi, Dr. Moore. I just wanted to get a little more clarity on, you said you're reviewing all public health measures, including the vaccine passports and mask mandates in some settings. So if you recommend ending those measures, could that potentially happen before the end of the reopening timeline in March or whenever it ends up being?
Yeah, thanks, Holly. So I can't presume what eventual government decisions will be made, but I think a review of all timelines is absolutely appropriate in the face of the improving data in Ontario and removal of all public health measures that have been in place. We're going to make some recommendations to government. Government will be reviewing those in the coming weeks and making decisions on them. We want to be transparent to businesses, transparent to Ontarians on what can be expected in terms of the timelines. We made the best estimates on February 21st and March 14th based on modeling. It's just that our situation has improved and no one wants to impede businesses any more than we have to, nor do we want public health measures a minute longer, as the Premier would say, than are necessary, and that is our commitment to all Ontarians.
Follow up, and this is the last question.
Yeah, I'm just wondering, you mentioned surgeries gradually resuming following this phased approach across the province, but I'm wondering if you can give more detail on like what that phased approach is going to look like. Is it going to be different depending on the situation, and kind of what order you expect procedures are going to start in?
Thank you so much, Holly. So we need to brief all of our health system partners, and I do believe Ontario Health has been doing that aggressively. We don't want to suddenly open up all the doors and have our hospitals busy. We really need to understand some hospitals are still quite busy with COVID activity, and there are regional variations in the level of COVID across Ontario, and we need to work as a system supporting each other. All hospitals are long-term care and public health, trying to ensure that patients can be provided the right care at the right time at the right place. So it will not be sudden, it will be gradual, as our plan is in Ontario, phased, monitored, and we want to move up to around 70% surgical capacity, and that is those that have been waiting for a new knee, a new hip, cataract surgeries. Those we want to return gradually without significantly impacting the system to ensure that we are able to provide care in those regions where there is increased COVID activity, and also to provide equity across Ontario. So we will do it in those phased approaches of around 70% of their surgical capacity keeping bed availability for COVID patients, then move up to around 90% surgical capacity. And then when we're in a recovery phase, which we anticipate being in late March and April, opening up surgeries back to normal volumes to then try to also do some catch up on any procedures that were significantly delayed. So I hope everyone's hearing staged, phased, evidence-based, cautious approaches are the mainstay in Ontario of how to return the health system back to recovery.
Thanks, everyone.